My name is Dr. Umesh Srikantha, working as a consultant and head of spine services at Aster Hospitals, Bangalore. In this video, I am going to give you a short introduction to lumbar disc prolapse. Perhaps the most commonly diagnosed spinal condition in a lumbar disc prolapse, especially in the present day scenario when investigations like MRI are easily accessible and affordable. It is one of the most commonest causes for low back pain, and of course the commonest cause for radical arc pain in the leg, generally what is known as sciatica. Well, lumbar disc prolapse is also known by several other common terms like slip disc, disc herniation, disc protrusion or disc bulge. Though they have some differences, and medically speaking each of them carry a different meaning. So for a common perspective, all of them are used with the same meaning, that is a disc prolapse. So what is a lumbar disc prolapse? Basically, the lower back is made up of 5 lumbar and the sacrum below it. In between these lumbar vertebrae is the disc, which is made up of a thick outer fibrous layer and a gel-like substance within. This inner nucleus is contained within the outer layer, the tough layer. With age-related wear and tear, the outer layer becomes weak. It gives away, due to which the inner material comes out. This is essentially called a disc prolapse. Well, what are the symptoms? Depending upon the severity of prolapse, the symptoms can vary. In a small disc prolapse, there won't be any compression on the nerve, and these patients usually have moderate to severe localized back pain, which worsens with activity or in some specific postures, which can vary from person to person. If the disc prolapse is large, then it causes nerve compression, which is when the patient starts developing pain in the leg, or sciatica, which is basically pain along the course of the nerve in the leg. Depending upon which nerve is involved, the pain distribution in the leg can be different. Of course, in several cases, if the nerve compression is severe or it's prolonged, the patient may develop signs of nerve impairment, which will manifest either as a numbness or a weakness in a part or a whole of the leg. In very severe cases, there may be complete weakness of a part of the leg, usually indicating a complete nerve damage, which also in many cases is associated with difficulty in passing urine or stools, a term what we commonly call as a Cauda Equina Syndrome. Well, the last few symptoms that were mentioned, that is weakness, numbness or difficulty in passing urine, are usually very grave signs or symptoms, and they warrant immediate medical attention and most of the times an intervention. So how do we diagnose this? Basically, a lumbar disc prolapse is diagnosed on an MRI scan. Many people ask if an X-ray can pick up a disc prolapse. Well, X-ray can diagnose only some conditions or probably hint at a presence of a disc prolapse, but it is never confirmatory. Even CT scans, for that matter, are inferior to MRI in evaluation of the spine for these degenerative conditions. Degenerative means these age-related conditions. But is MRI necessary in all cases of back pain or leg pain? Of course, no. Please watch our video shown in the link on when not to neglect back pain or when a doctor consultation is needed whenever you have low back pain or leg pain. Well, continuing the talk, also all large or disc prolapses do not cause numbness or weakness. In fact, in the early stages, most patients just have pain, irrespective of the size or the severity of disc prolapse. It is important to identify such cases so that appropriate precautions can be taken, initiated early, before it causes more damage and makes the condition worse. Well, for information on what you do once you are diagnosed with a lumbar disc prolapse, please watch our next video in this series, the link to which is displayed on the screen. And for more such videos, please subscribe to our YouTube channel, Spine 360. Thank you.